The Senate Committee on Government Affairs will come to order. Madam Secretary, please call the roll.
Senator Daley. Here. Senator Ellison. Senator Krasner. Here. Senator Neal. Senator Orenshaw. Present. Senator Rogich. Here. Chair Flores.
Present. Please let the record reflect we have 6 members present. We do have a quorum. Please mark Senator Neal as absent excused. Good afternoon, everyone, to the very hardworking Committee on Government Affairs. It's a pleasure to have you all joining us today. Just as a matter of housekeeping, I want to remind everybody who's joining us today to please sign in if you have not had an opportunity to do so. For those of you who will be testifying, please provide your contact information to our committee secretary so that we may be able to contact you at a later time if necessary. We're all working off of our computers. Please don't take that as a sign of disrespect. Everything you see on those monitors, we can see here. We have 3 items on the agenda, but before we get into the items on the agenda, I do want to give everybody a little bit of a roadmap of how we're going to be moving forward here in GA. We don't intend on meeting this Friday. So for those of you who have family, plan accordingly. We're not going to be meeting here. However, after this week, we'll be meeting Monday, Wednesday, and Friday as we're getting near deadlines, and unfortunately just sacrificing Fridays won't be an option moving forward. We intend to stack both Monday and Wednesdays heavily so that we may keep Fridays as light as possible, but light only means maybe keeping it to 2 or 3 bills, as that's all we can do. But we plan to be here late Mondays and Wednesdays and then keep Fridays as light as possible, particularly because we have some members on the committee that need to drive immediately after very far, and want to make sure that we're taking care of our members. So that gives everybody the lay of the land. On the agenda, we have Senate Bill 208, Senate Bill 266, and Senate Bill 298. We'll likely be taking them slightly out of order, starting with Senate Bill 208, followed by Senate Bill 298, and then lastly, Senate Bill 266. With that, I'd like to open up the hearing on Senate Bill 208. Senator Steinbeck, welcome. Whenever you are ready.
Thank you, Chairman Flores, and thank you to everybody on this committee. I appreciate your time. Good afternoon. My name is John Steinbeck, for the record, and I'm representing Senate District 18 in Clark County. And I should be, I appreciate the opportunity to present Senate Bill 208 today, which addresses the use of revenue collected from telephone surcharges. With me today to present SB 208 is also Rich Hogan, and he's joining in Las Vegas. Rich, would you go ahead and come on up to the seat as well, please? And Mr. Hogan is the Chief Financial Officer for the Las Vegas Metropolitan Police Department. Under existing federal law, the Federal Communications Commission regulates the use of funds collected from surcharges for emergency 911 services to prevent their diversion. These funds are primarily used to support and implement emergency services and manage public safety answering points, which is commonly known as your 911 dispatch. In Nevada, counties have been authorized to impose surcharges for enhancing emergency telephone systems and purchasing recording devices for law enforcement. Excuse me. However, the current framework requires updates to align with evolving needs and regulatory requirements. For that purpose, SB 208 expands the permissible use of surcharge revenue to include costs associated with construction or upgrading facilities for emergency telephone systems. This is an allowable use by the Code of Federal Regulations, Title 47, and has been reportedly adopted in over 40 states. SB 208 also increases the maximum fund balance to $15 million in counties over 700,000 in population, and through a friendly amendment with Washoe County would raise the threshold in counties between 100,000 and 700,000 to 7,500,000. This bill does not raise the surcharge fees that are charged our citizens, as that is all controlled by the county level. There are two proposed amendments after discussions with various stakeholders. I would like for you to consider these amendments, which should also be available on Nellis. And I'll briefly touch on them before handing this over to Mr. Hogan for additional remarks. The first amendment puts back all of the language that was removed in the bill with reference to 911 surcharge used for body cameras. The original language was an effort to improve Nevada's compliance with federal regulations. However, the language was reinstated, right, into the bill into the original NRS statute due to the possible shortfall of local government budgets and our desire to not adversely affect them. And as previously mentioned, the second one increases the amount counties can collect that are between 100 and 700,000 in population. At this time, I'd like to go ahead and turn it over to Mr. Hogan for additional information.
Thank you, Senator. Again, for the record, as Senator Steinbeck mentioned, my name is Rich Hogan. I'm the Chief Financial Officer of the Las Vegas Metropolitan Police Department. Just wanted to thank Senator Steinbeck for bringing these proposed changes to the statute forward for consideration. The two changes, particularly the changes as it relates to the allowability of the funds for construction, will be very beneficial to Southern Nevada in particular. One of the, as you may have heard, there's been some press on this topic as well, but we're looking to construct a joint communication center. Those funds would potentially, with this change, allow us to use some revenue to offset the cost of constructing that facility, probably not entirely, but at least in part. And then just some sort of conforming pieces of that is the amount of carryover increasing from 5 million to 15 million is just sort of a practical matter. It's very hard when you're engaging in a large construction project or even just the recurring expenses that we have in Clark County related to our 911 system. It's very difficult to kind of operate with as a $5 million fund balance. It sort of made sense early on when this statute was put in place, but times have changed and we just need a little bit more latitude to be able to build up a fund balance sufficient for some of those one-time expenditures that we anticipate happening in the future. So we appreciate your consideration.
And thank you for joining us. At this time, we'll open up for questions. Members, any questions? Senator Krasner, please.
Thank you, Chair. Thank you, Senator Steinbeck, for your presentation. So I'm sorry, I'm looking at Section 2, Sub 2, where it says that some of the money from the 911 can be used for the purpose of purchasing and maintaining portable event recording devices, like the body cams that our law enforcement officers wear. You're saying that it's crossed out now, but you're adding it back in. Is that correct? So that
is correct. Everything that has been crossed out with reference to portable event recording devices, which was part of this original bill, has been eliminated. So that part of the statute will not be touched.
So, Chair, will follow up. So it's a little bit confusing because you have it crossed out and that, but now you're putting it back in. So that would mean that money from 911 would not be able to be used for the body cams.
Senator Steinbeck, for the record, Chair. No, money from 911 surcharges would not change at this point in time in any way, other than to be available to be used for facilities. However, the use of those funds for body cameras, like Washoe County is currently doing, will not change. So the original bill crossed out the use of those funds for body cameras. The amendment put that language back in.
So the money can be used for the law enforcement body cams.
That is correct, Senator.
Okay, great, thank you.
I know that it is confusing to say we are putting back in the language that we took out, but that's really what we are doing, and that's what the conceptual amendment that legal put together as well states. Yes.
Yes, and we will get clarification from our legal counsel.
Record, this is Heidi Clarkson with the Legal Division. Just to clarify, the bill as introduced did propose to remove authority to use these fees for body cameras. What the conceptual amendment proposes is to eliminate those sections from the bill. Therefore, those sections, if this amendment is adopted by the committee, those sections will be deleted. Those sections will not be repealed from the law. They will just be deleted so that this bill moving forward does not affect those sections.
Thank you, Ms. Clarkson. Members, any additional questions? Senator Daley, please.
Thank you, Mr. Chair, and I got the part on the amendment and on what happened with that. The question was on the use for construction funds, and I'm fine with that. Is it for all counties or just Washoe and Clark? I know that was a little bit confusing going back. I know you want to raise it to, I believe, 15 million for Clark County. And then I saw the Washoe County amendment to 7.5 million. Does it apply to all of the counties or just the two large counties that can use that for construction?
Thank you for the question. Thank you, Chair. So any county that enacts the 911 surcharge would have the ability to use them for the facility use. The only thing that's different between the different counties by population is the amount that they can hold before having to return funds back. So the counties under 100,000 as written, and I'll ask legal to confirm this as well, but the counties that are under 100,000 would remain still at that $5 million threshold.
Understood. I just wanted to be clear on that. I thought I saw that, and I saw the amendment, and I was just making sure that the levels based on the population. So thank you. That was my only question, Mr. Chair.
Next, we'll go to Senator Ellison, please.
Thank you. I think it's important for the body cam, but I do have a question. This is an enabling bill the county's got to implement. Or is it mandatory? That's my first question.
Thank you for the question. Senator, this only, if a county enacts the surcharge and collects it, this allows them to be able to utilize the funds for those purposes set aside in NRS. This has nothing to do with a county having to enact the 911 surcharge, and it doesn't direct a county as to how they have to use those funds, other than within the parameters that are stipulated in the law already and with this adjustment. So it adds a little bit of latitude for the counties to be able to decide how to use their 911 surcharge funds and doesn't mandate anything.
Please.
They put the 911 surcharge in years ago. I mean, we're involved with that. But that money was to be used for body cams because they actually had to make some changes to actually use that for the body cams because the money was actually used for maintenance and to upgrade the 911 system. So is this bill going to change any of that at all? I don't see that.
Thank you for the question, Senator Ellison. No, the original language would have changed that, and that was to put us in compliance with federal regulations. Nevada is and will remain on the diversion list with the FCC because we utilize that money for body cameras. However, with the amendments that have been changed, that will not change the ability for any of the local governments to utilize that money for body cameras.
Thank you very much. And may I be excused for a minute, sir?
Please. Thank you, Senator Ellison. Members, any additional questions? Seeing none, thank you, Senator. I'd like to invite you to sit back in the gallery. And at this time, I'd like to invite those wishing to join us in support of Senate Bill 208. If you could please come forward, either in Carson City or Las Vegas. I see folk both in Carson City and Las Vegas. I think we just have somebody, one individual in Las Vegas, so we'll start with Las Vegas and we'll come back down to Carson City. Good afternoon, welcome in Las Vegas.
Thank you, Mr. Chair and members of the committee. My name is Ashanti Gray, for the record, and I'm here representing Las Vegas Fire and Rescue, where I'm an assistant chief and director of the Combined Communications Center. I am here today in strong support of this critical legislation. The Combined Communications Center is the second busiest 911 center in Southern Nevada, providing emergency call taking and dispatch services for Las Vegas, Clark County, and North Las Vegas fire departments. In 2024 alone, we handled over 600,000 calls. That's approximately 1,685 calls per day, or 70 calls every hour, a continuous stream of emergencies. This resulted in over 13,000 fire responses, over 300,000 EMS responses, over 18,000 other emergency responses, and 29 hazardous incident responses. By allowing the 911 surcharge to fund next-gen 911 technology, we can locate callers more accurately, reducing response times. Because in a cardiac arrest, a fire, or an active shooter situation, seconds mean the difference between life and death. It also permits the use of funds for facility upgrades and new construction. The Combined Communications Center, Las Vegas Metropolitan Police Department, and the City of North Las Vegas are co-locating at a new shared facility. This will improve real-time coordination between law enforcement, fire, and EMS, enhance disaster resilience with backup capabilities, and reduce construction costs through shared infrastructure. Co-locating emergency communications ensures that during major incidents, first responders receive the same critical information at the same time. This eliminates delays, streamlines decision-making, and saves more lives. This legislation is an investment in public safety. It modernizes our technology, strengthens coordination, and protects our community. I urge your support. Thank you.
And thank you for joining us. Is there anybody else in Las Vegas? Seeing none, we'll move to support here. Oh, I'm sorry, I do see somebody stepping up. If there's anybody else in Las Vegas, please feel free to occupy the other two seats. Whenever you're ready, sir.
Thank you, Chair. Thank you, Senators. Brian O'Neill from Clark County, last name O''Neal. Speaking in support of 208. Technology improvements to enable next generation 911 and public safety answering points will enable responders to arrive to the right calls with the right resources faster than we ever have. It's important to have flexibility in spending the 911 surcharge funds in a way that allows the right technology to be tested, trialed, and implemented in a deliberate way without rushing due to fiscal timelines. Allowing more funds to carry over year to year will allow greater flexibility and acknowledges the pace of change with the technology improvements to ensure effective changes are being made that will improve public safety. Thank you very much.
And thank you again for joining us. Wanted to confirm there's nobody else in Las Vegas. Seeing none, we'll move to Carson City. Whoever wishes to go first.
Hello, Chair Flores, members of the Government Affairs Committee. My name is Troyce, Troyce, last name Krumi, Krumme. I'm the current chairman of the Las Vegas Police Managers and Supervisors Association. We represent the sergeants, lieutenants, and captains with the Las Vegas Metropolitan Police Department. We are here in support of SB 208. Simply put, these funds are going to be used to upgrade 911 systems. When our community members pick up the phone and dial 911, they expect to be able to have a good connection, a fast answering service, and that the help will be shortly upon the way. These funds will go a long ways to ensuring that our first responders have the ability to protect our community members. Thank you.
And thank you for joining us. Welcome.
Good afternoon, Chair Flores, members of the committee. For the record, my name is Cadence Matijevich, spelled Cadencematijevich, representing Washoe County. And as Senator Steinbeck mentioned when he presented the bill, Washoe County is in support of the bill, but we are coming forward with an amendment today. That amendment is to Bill Section 3, beginning on page 8 of the bill. So it's subsection 7 of Bill Section 3, and that is to amend the population cap that currently applies. You see that in Section 6, the new pop cap has been added for Clark County. This adjusts the population cap for Washoe County to clarify that our ending fund balance amount, allowable ending fund balance amount, can be raised to 7.5 million from the current 5 million, for the same reasons that you heard earlier. We appreciate that that the senator is bringing specificity to this law, that we can use this for construction and improvements to construction of new facilities or improvements to existing facilities. And as you heard, we may need to accumulate funding to take on those projects. Additionally, this also recognizes that the buying power of $5 million when this was originally put into place is not the same as it used to be. And so we appreciate that. Additionally, I want to give my thanks to Senator Steinbeck for understanding that the original version of the bill would have had a significant fiscal impact on some of the local governments in the state. We appreciate him bringing the amendment forward. Thank you.
And thank you for joining us. Please, whoever wishes to go next.
Good afternoon, Chair and members of the committee. My name is Casey Froidevaux. It's CAYCI-FROIDEVAUX. I'm from the city of Reno. I'm a public safety dispatch supervisor. I appreciate the opportunity to speak in support of Senate Bill 208. It's critical to enhancing our state's emergency response capabilities. 911 professionals are the first responders. Every second matters in an emergency, and this bill provides support to ensure that we have the resources, training, and infrastructure necessary to provide the highest level of service to Nevadans. Whether it's funding for technology upgrades or operational support, SB 208, along with the proposed amendment to Section 3 on page 8, strengthens the foundation of our emergency communication system and provides expanded tools that can support 911 centers. This bill addresses the population growth in our state and helps support funding in counties in a more proportionate manner. I urge the committee to support this bill for the safety of our communities and the well-being of those who answer the call when Nevadans need it most. Thank you to Senator Steinbeck and to Washoe County for proposing these friendly amendments, and thank you for your time and consideration.
Thank you for joining us. Welcome.
Good afternoon, Chair Flores, my name, and members of the committee, My name is John Abel, Johnabel. I'm the Government Affairs Director of the LVPPA. Dispatching and call taking are a cornerstone of policing. Without them, we could not adequately keep our community safe in Nevada, and for that reason, we support this bill. Thank you.
And thank you for joining us. Good afternoon. Welcome.
Good afternoon. For the record, Ryan Beeman, Beaman, representing the professional firefighters in Nevada. First, I would like to say thank you to Senator Steinbeck for sponsoring this important piece of legislation and to the chair and the committee for hearing this bill. I'm here today to express my strong support for SB 208 as a critical piece of legislation that directly impacts the safety and efficiency of emergency response systems in Nevada. As a firefighter, I have witnessed firsthand the importance of a reliable and well-funded emergency communication system. SB 208 proposes revisions to use the revenue collected from the county imposed by a telephone surcharge to ensure these funds are allocated and the essential upgrades take place. As firefighters, we rely on seamless coordination of emergency service to do our job effectively. SB 208 strengthens this coordination by investing in the backbone of our emergency response system. It is investment in the public safety and the well-being of our citizens and the future of our state. I urge you to support SB 208. Thank you.
And thank you for joining us. Good afternoon.
Good afternoon, Chair Flores, members of the committee, Nicole Rourke representing the city of Henderson. I want to echo the comments of support from my municipal colleagues and also thank the sponsor of the bill for bringing this forward. We look forward to the opportunity of this additional financial support for our 911 system and to better serve the residents of the city.
Thank you for joining us. Welcome.
Good afternoon, Chair Flores, Vice Chair Orenshaw, members of the committee. My name is Wesley Harper. I am the Director of Government Affairs for the City of North Las Vegas. We certainly echo the sentiments of the supporters of this bill thus far. We appreciate Senator Steinbeck for bringing it forward. It strengthens public safety. Therefore, we are in support. Thank you.
Thank you. Is there anybody else wishing to testify in support of Senate Bill 208? Seeing none in Carson City or Las Vegas, BPS, do we have anybody wishing to join us over the phone?
If you would like to testify in support of SB 208, please press star 9 now to take your place in the queue.
Hello, this is Al Rojas from Assembly District 12, Senate District 21. First of all, not only am I in support of this bill, I am so glad to see so many so many people who are involved in our security, who are concerned about our security. Unfortunately, I just gave a testimony at one of our commissioners' meeting, and I made a comment, and our security was not taken as seriously as I felt it should have been. And I'm really glad to hear that all of these all these people who are testifying really do care about our security, and I want to thank them. I am in total support of this bill. I thank our legislators and everybody who testified in support. Thank you very much.
And thank you for joining us, sir. Next person in support of Senate Bill 208.
Chair, you have no more callers wishing to testify in support at this time.
Thank you. At this time, I'd like to invite forward anybody wishing to testify in opposition to Senate Bill 208, Carson City or Las Vegas. Seeing no one coming forward in Carson City or Las Vegas, BPS, do we have anybody wishing to join us over the phone? Opposition.
If you would like to testify in opposition of SB 208, please press star 9 now to take your place in the queue. Chair, you have no one wishing to testify in opposition at this time.
Thank you. Lastly, we'll move to the neutral position for Senate Bill 208. Anybody in Carson City or Las Vegas wishing to testify in the neutral position? Seeing no one in Carson City or Las Vegas, BPS, we'll go to the phone lines, please.
If you would like to testify neutral on SB 208, please press star 9 now. Chair, you have no callers wishing to testify neutral at this time.
Fair enough. Thank you. Senator, any closing remarks you may have?
Thank you, Chairman Flores. Thank you to every member of this committee, John Steinbeck, for the record. I'd just like to close by saying we really appreciate your consideration of this. As you can tell from the people that are here in support, this is a needed item to improve a critical piece of emergency services. Our 911 dispatchers are the unsung heroes in the emergency providers. We don't always understand how much we rely on them, but firefighters, emergency medical, police officers go through hundreds, even thousands of hours of training. We put a tremendous amount into those resources, and they go unused improperly if you don't get the right call and get the person out at the right time with the right information. Much of our infrastructure throughout the state is antiquated, both the facilities and the equipment, and we need to make these upgrades, and really appreciate your consideration on this bill so that the counties and local jurisdictions can move forward. Thank you, sir.
And thank you, Senator. And with that, we'll go ahead and close out the hearing on Senate Bill 208, and next move on. Fair enough. Senator Taylor, are you good to go? I know we were concerned about potentially having a conflict. Are we good? Perfect. Well, then in that case, we'll take the items in the order they appear on the agenda. So at this time, I'd like to go ahead and open up the hearing on Senate Bill 266. Senator Taylor, whenever you're ready. Please, whenever you're ready.
Okay, thank you. Good afternoon, everyone, and thank you for this opportunity to present Senate Bill 266. My name is Angie Taylor. I am the senator from Senate District 15 in Washoe County, and I'm excited to be here. I'm presenting today, and everyone will introduce themselves, but I have some great folks here helping me because that's the best way to do it. Let me give you just a little bit of background. The Senate Bill 66 revises provisions governing the student loan repayment for providers of healthcare in underserved communities. It's a program. You can see it's a very short bill, so let me talk just a little bit about it. The Office of the State Treasurer administers the student loan repayment program for providers of health care in underserved communities program. That started last session. It was Senate Bill 45 in the 82nd session, which was just last session. The objective is to incentivize healthcare professionals to practice in areas where their services are most needed, again, underserved communities. The program enhances healthcare access and equity in underserved areas of the state and improves our overall healthcare workforce. Chair, with your permission, our intern will walk us through the bill.
Thank you, Senator Taylor, Chair Flores, and members of the committee. My name is Fiona Perot. First name is Fiona, and last name is Pereault. So, Section 1 of this bill already included physicians, physician assistants, dentists, nurses, certified EMS and paramedics, optometrists, audiologists, respiratory care practitioners, podiatrists, psychologists, clinical professional counselors, perfusionists, pharmacists, and pharmacy technicians. This would add marriage and family therapists, clinical license and certified alcohol and drug counselors. Additionally, it also already included midwives and doula service providers. So Senate Bill 266 will introduce marriage and family therapists, clinical license and certified alcohol and drug counselors.
Thank you so much. Thank you so much, Angie Taylor, for the record. Thank you, Chair, and the committee. Basically, this is adding an area that we left off, quite frankly, last year, and really wanting to incentivize people in underserved areas, but much-needed professions to be in those areas to help our Nevadans in these areas where they need most. And to talk about that and why it's important, we have someone who walks in both of those areas, right, as a marriage and family therapist as well as a substance abuse counselor. Go ahead, Doctor.
Okay, good afternoon. I'm Dr. Ruth Ann Wright with a W. And I want to thank Senator Taylor and the members of the committee for the chance to testify today in favor of these revisions to Senate Bill 266. I'm here as a licensed alcohol and drug counselor. That's an LADC. I'm also a licensed marriage and family therapist, an MFT, and I'm a licensed psychologist. I have held these first two licenses since 1988, but I am a relatively newcomer to psychology. I've only been licensed since 2009, okay? I go into such detail to point out that I am an MFT and an LADC who's been licensed for 37 years. Okay, these two professions that have been left off the list of providers have a long history in Nevada. They've been regulated since the 1970s. Marriage and family therapists were first regulated and recognized in 1973, and drug and alcohol counselors in 1975. Both of these professions were licensed before clinical social workers, who were licensed in 1989, and well before clinical professional counselors, who were licensed in 2007. Okay? I'm going to skip some of what I wrote because they already said it, okay?
You're good.
Okay. As a licensed practitioner of the mental health healing arts, I know that MFTs, LACDCs, LCSWs, and clinical psychologists all provide similar services, okay? Albeit that they come from very different theoretical orientations and offer a different kind of therapy as it is. Okay, I think that the wider the type of professional that's available, the better Nevadans are served. Let's see. I want to talk to the fact that I have recently closed my clinical practice, and at this point in my career, my primary focus is supervising interns, CPC and MFT particularly. I have been privy to an incredible amount of information about the debt my interns have incurred in their desire to become licensed MFTs and CPCs to provide therapy and counseling to Nevadans in need. I value and have supervised interns from diverse backgrounds and populations. I have done television with I have supervised interns who speak Spanish as their first language. I now have former interns who are now licensed professionals currently working with rural populations in various local high schools, in private behavioral mental health agencies, in state-funded programs, nonprofit organizations, and in private practice. I know full well how beneficial to both underserved populations but also struggling interns this revision will be. Thank you for listening.
Thank you, Dr. Wright. If I may just summation, this bill, Senate Bill 266, it just expands the definition of provider of health care in the pertinent statute to include marriage and family therapist, clinical alcohol and drug counselor, and a licensed certified alcohol and drug counselor. This small change will let these professionals participate in the program. It's just to correct a wrong, an oversight from last session. So I know this is a policy committee and not a fiscal committee, but just so you know, I want to mention that the state treasurer's fiscal note indicated zero fiscal impact for this bill. We stand, Angie Taylor for the record. Thank you, Chair. We stand ready to answer any questions. Thank you, Mr. Chair and the committee.
And thank you all three for joining us in your presentation today. Members, any questions? We'll start off with Senator Ellison, please.
Thank you very much. When I read the bill, it said related to health care, authorizes certain provides a behavioral health services, particularly in students with loan payments. So in other words, is this like if there's a charge from somewhere, does that go into their student loan, or is it? I was kind of confused about that. And then the other question I got is, doesn't Medicaid pick up part of this?
Mr. Chair, through you to the Senator. Okay. Thank you, Senator, for the question. Angie Taylor for the record. Medicaid does not provide this service for this. This is a payment to the professional. So Medicaid pays for the service if the patient qualifies and is a part of Medicaid. This is something very different. This is a student loan reimbursement for people who have gone through these programs, right? The whole list, go back to that list, because it's a pretty comprehensive list.
Yeah, I read it.
Right? There we go. There was 2 slides to it, but we get the gist, right? And because we really need these services in those underserved communities. And the way the program exists now is in the state treasurer's office. This is a program that was established in the state treasurer's office last session. There's an amount of money, there's a pool, and then people apply for the pool, and then those who are awarded it are awarded based upon the need, the area, and the profession that they represent. There's much more demand for this than we currently fund right now, just so you know. But what this does really is just says we need these mental health professionals in our communities, especially our underserved communities. And this is something we can do to help entice them to stay once they graduate and then to serve those communities that need it most.
Senator Krasner, please.
Thank you, Chair. Thank you for your presentation. For those people who don't know exactly what the program does, could you just kind of spell it out step by step, this student loan reimbursement program? How long do they have to practice in the underserved area? Just a little background, please. Thank you.
Thank you, Senator, for the question. Angie Taylor for the record. The way the program works is students apply, not students. Once you're a professional, you apply to be considered for this loan repayment program. And part of your being able to receive the loan for that year, the repayment for that year, is serving in that underserved community for that year. It isn't like we're paying for their entire career, right, as a professional. And then we'd say, hey, how many years are we going to get from you in Elko, in Ely, in this low-income neighborhood, or on one of the tribal communities or something like that. So if you apply each year, you have to apply again.
Thank you.
Next, we have Senator Rogich.
Thank you for presenting today. My question is with regard to who is the applicant? Are these individuals that have graduated from a university or college in Nevada, or are they coming from out of state and seeking reimbursement in order to work in that particular field?
Thank you for the question, Senator Rogich. Angie Taylor for the record. That is the line I don't remember, but I have to look it up and tell you for sure. My understanding of it, though, as I remember it now, because it was 2 years ago when we passed this thing, is that these are for graduates from our universities here, our colleges and universities here in the state of Nevada. But I'll get that and make sure I get it to the community to have it.
And then we'll have our legal counsel jump in on this as well.
Oh, okay, thank you. I was going to say, she knows.
Record, this is Heidi Clarkson again with the Legislative Council Bureau. To be eligible, a person does have to be a resident of the state of Nevada. They have to be a current resident. They have to be actively licensed, certified, or registered in good standing to practice in the state as a provider of healthcare, so they already have to have their license. And they have to commit to at least 5 years of clinical practice and in an underserved area, and that would include any rural county, on tribal lands, and in certain communities that have been designated by a census tract as sort of a qualified census tract or have a high level of social vulnerability as determined by the CDC. So there is a requirement that they already have to be a resident of the state. I don't see a requirement that they have to have gone to school here, though.
Next, we have Senator Daly, please.
Thank you, Mr. Chair, and I don't really have a question. I understand your bill and everything. I just wanted to point out that I was supposed to go first, but I said we should let Angie go first because I have to be here anyway. So now you owe me. I'm kidding. No. Happy to do that. I understand the bill. It's a good catch in addition to an existing funded program, at least to the levels that we have. People just have to apply. So thank you.
Thank you, Senator Daly. Angie Taylor for the record. I didn't remember the 5-year part, so thank you for that clarification. I knew they're for people in our state, and it's just really to help us meet a need that we have, and we don't have enough. The fund isn't enough for all that we need, but certainly for those that we can get, let's get and keep and hold on to. And I believe Dr. Wright wanted to add to this. Get your name for the record.
Dr. Wright for the record?
Yes.
Okay. I just wanted to comment, excuse me, on the fact that many of our professionals, the interns that I work with, live and reside in Nevada and attend colleges online. And so they might not be going to like UNR or UNLV, but they are living in Nevada while they go to college. And that costs money too. So that's my comment.
If I may, Mr. Chairman, Angie Taylor for the record, they have to be licensed in order to apply for this and so on. So they may be taking other studies, but they have to have their license in order to qualify for the program.
Members, any additional questions? And Senator Daley was obviously very upset that he needed to get that on the record, Senator Taylor. With that, I'd like to invite all three of you to please sit back in the gallery. Thank you for your presentation and answering the questions today. I'd like to invite anybody wishing to testify in support of Senate Bill 266, either in Carson City or Las Vegas, to please come forward. We'll start in Carson City, and then we'll make our way back to Las Vegas. Good afternoon, welcome.
There we go. Good afternoon, Mr. Chairman and members of the committee. My name is Sarah Adler, and today I am proud to represent our client Vitality Unlimited, which is a rural healthcare provider of ASAM 3.5 level residential treatment, substance use disorder treatment services, as well as operating certified community behavioral health centers in Elko, Dayton, and Carson City. So the wonderful sponsor may not know this, but this is a licensed alcohol and drug counselor equity bill. And it is a continuation, in my mind. In 2021, Senator Goicoechea, your predecessor, sir, carried SB 181 because at that time you had to have 1,000 more supervised hours, intern hours, to get your LADC license versus your licensed clinical social worker license. And this was a real detriment to encouraging people to become licensed alcohol and drug counselors, which of course we have a desperate need for in our state, particularly in these underserved areas. And the folks who are receiving services are largely Medicaid eligible folks. So Vitality, a manager of these services, is not able to pay a market wage that allows you to repay your loans very easily. So last session, I sought to get LADCs included in this loan repayment program and was not successful, but I am absolutely thrilled to see them included in this bill. And we encourage your strong support of SB 266. Thank you.
And thank you for joining us. Good afternoon.
Good afternoon, Chair and committee members. My name is Sabrina Schnur, Sabrina Schnur, and I am here on behalf of the Nevada Primary Care Association and Nevada Public Health Association. We want to thank Senator Taylor for bringing forward this bill, and we are just here to offer a ditto today to all of the comments. Thank you.
Thank you for joining us. Good afternoon.
Good afternoon, Chair and committee members. Kanani Espinoza on behalf of Nevada State University. Although Nevada State University does not currently offer master's programs in counseling, we are committed to accelerating the pipeline of qualified counselors. Many of our students complete an 18-credit course counseling minor with a specialization in addiction treatment. This minor significantly reduces the required supervised work hours to become a certified alcohol and drug counselor by over 50%, equating to more than 1,500 hours. Consequently, many of our students become credentialed and pursue a master's degree. Given the critical nature of these positions, especially in underserved areas, graduates who dedicate themselves to this work would greatly benefit from the student loan forgiveness provided by this bill. In addition, I'd like to provide support on behalf of UNLV. There is a very similar bill in the Assembly that we were able to co-present, and we appreciate all eyes on this bill. Thank you.
Thank you for joining us. Good afternoon.
Bobby Ernott, for the record, with R&R Partners here on behalf of the American Association of Marriage and Family Therapy. Our members are thrilled at the opportunity to utilize this great program, and we just want to thank the sponsor for bringing the bill forward. Thank you.
And thank you. Good afternoon. Welcome.
Good afternoon, Chair Flores, members of the committee. For the record, Cadence Matievich representing Washoe County. Increasing access to behavioral health services is a priority for Washoe County. As some members of this committee may know, Washoe County, with assistance from the state, has purchased a behavioral health hospital and are in the process of renovating that to have it reopened in our community. The workforce for that is foundational to the access to these services. And so we are grateful to Senator Taylor for bringing this bill forward to help recruit and retain this critical resource for our community. We ask for your support. Thank you.
And thank you for joining us. Good afternoon, welcome.
Good afternoon, Chair Flores, Vice Chair Orenshaw, and members of the committee. My name is Kira Kramer, for the record, Kira Kramer. And I'm a public health student and UNLV honors student. I'm here today to express my strong support for this bill that will expand student loan repayment for providers of health care in underserved communities, and to include behavioral health providers such as marriage and family therapists and alcohol and drug counselors. As a public health student, I understand the critical need for mental health and substance use disorder services in our community. These communities often face significant barriers to accessing care, including a shortage of trained professionals. By expanding the scope of this program, we are not only helping individuals who have dedicated their careers to helping others, but also ensuring that those in need of behavioral health services can access them more easily. This bill directly addresses the shortage of behavioral health providers in underserved communities by incentivizing professionals to work where they are most needed. The burden of student loan debt is a significant barrier to entering and staying in these communities, and offering loan repayment assistance is an effective strategy to attract and retain qualified providers. By supporting these professionals, we are investing in the well-being of our Nevada communities as a whole. In my own personal life, I would like to share that the support of marriage and family counselors and therapists has helped me be a successful student at UNLV by helping me navigate family dynamics, as I have a family with members who have disabilities and special needs. And their services are key and instrumental to helping me be successful as a student. It is a struggle to find providers covered by our insurance, and increasing access to providers is necessary for Nevadans. In conclusion, this bill is an important step forward to expanding access to much-needed behavioral health services in underserved areas, and I strongly encourage you all to support it. Thank you to the legislators that helped bring this bill forward, and thank you all for your time and consideration.
And thank you for joining us. Good afternoon, welcome.
Good afternoon. Thank you, Chairman Flores, and every member in this committee. To start, my name is Edward Delgado. I'm a second-year political science and history major with the Honors College, and I'd like to state for the record that I'm speaking on my own accord. I'm in support of Senate Bill 266. The American Association of Medical Colleges ranks Nevada among the lowest, and I repeat, the lowest in primary care physicians. Of course, the root issue is funding. Undergraduates spend endless amounts of hours studying and thousands of dollars for their bachelor's degree, all to take out loans to progress their journey to become marriage and family therapists and substance abuse counselors. As a legal aid intern, I have seen countless of individuals seeking a divorce at the Family Court Self-Help Center, and countless of evidence exhibits where substance abuse is involved in marriage and custody cases. Including aspiring family therapists and substance abuse counselors to the student loan repayment for providers of health care in underserved communities program will increase the amount of clinical and licensed workers in these respective fields, decrease the amount of divorces filed in the state of Nevada, and will address the drug issues and concerns in both northern and southern Nevada. Thank you again, Chairman Flores, and thank you to Senator Taylor for your sponsor on this bill.
Thank you for joining us. Is there anybody else wishing to testify in support of Senate Bill 266? Seeing none. I'm sorry. We do have somebody in Las Vegas. We'll go to Las Vegas, please.
Thank you, Chair Flores and members of the committee. Doug Unger, DOUG, UNGER, Nevada Faculty Alliance, and member UNLV Employee Benefits Advisory Committee. Nevada faces a medical provider shortage, which is well documented. This is especially so for behavioral health providers, including skilled drug abuse and alcoholism counselors and family therapists for underserved communities. Studies show nationally that students who complete degrees in a state tend to remain and practice in that state at an approximate rate of 62%. SB 266 provides an additional incentive for those students who learn skills and become certified in these crucial behavioral healthcare fields, or those who move to Nevada from out of state to remain in practice in our state and serve our citizens most in need. especially during these most uncertain times when federal support is at risk. Our state stepping forward to assist with student loan repayment for healthcare fields vital to the well-being of our state more than makes sense. It will help fill the healthcare needs of our community. The Nevada Faculty Alliance stands in support of SB 266. Thank you.
And thank you for joining us. Anybody else in Las Vegas? Seeing none, BPS, do we have anybody wishing to join us over the phone in support of Senate Bill 266?
If you would like to testify in support of SB 266, please press star 9 now to take your place in the queue.
Good afternoon, committee. This is Sheila Bray from the University of Nevada, Reno. I'm calling in full support of Senate Bill 266. Within the University of Nevada, Reno and our School of Public Health, we have a program, and the only program in the state, that focuses on clinical alcohol and drug counseling, as well as alcohol and drug counseling license programs. We are in full support of this as it provides more help for our behavioral health pipeline, so desperately needed within the state. And as previously mentioned, there was a similar bill in the Assembly, Assembly Bill 269, that has an amendment that looks to also expand to public health professionals in the state, and we're also in support of that. And just thank you to Chair Taylor for bringing forth this very important issue, and thank you, committee.
And thank you for joining us. Next caller in support of Senate Bill 266, excuse me.
Hello, yeah, this is Al Rojas in Assembly District 12, Senate District 21. I want to thank Senator Taylor for addressing or creating this bill. Mental health is a serious issue. Our sheriff down here, Kevin McMahill, had the Wellness Center developed to do for mental health for our officers, and it's been very successful. She may want to look into how they're doing it to help, but it's been very, very helpful for our sheriff. We have a big problem here with domestic violence and the homeless. You know, we're trying to work on that. As a member of many successful neighborhood watch groups, we're seeing that mental health is a big issue. And I want to thank Senator Taylor. You know, I believe she has a PhD, that she hasn't forgotten about our inner cities. She cares about us. And I'm totally in support of this bill. Thank you, Senator Taylor. Thank you.
And thank you for joining us. Next caller in support of Senate Bill 266.
Good afternoon, Chairman and committee members. My name is Aiden Casey, AIDANCASEY for the record. I serve as an intern for the Department of Government Affairs for the Associated Students of the University of Nevada. Since 1898, the Associated Students of the University of Nevada has represented the undergraduate student body at UNR. Today, I'm here to express our strong support for SB 266, further expanding student loan repayment for providers of healthcare in underserved communities. According to the 2023 ASUN Issues and Priorities Need Assessment, 74% of students identified financial concerns as the #1 issue. Many of these students come from Asian, Black, Indigenous, Latinx, Pacific Islander, and multi-ethnic backgrounds. Second to financial issues, career development remains the second most pressing issue for our undergraduate students. As demonstrated using this data, it is evident that students need aid in relieving the financial burden that accumulates when going through systems of higher education. SB 266 addresses the critical issues students are facing and provides vital solutions by expanding the definition of provider of healthcare to now include marriage and family therapists and clinical or licensed and certified alcohol and drug counselors. Both of these are supported by undergraduate degrees at the University of Nevada, Reno. Many of our students move on to pursue careers within these fields, further contributing to the betterment of our state. Assistance in student loan repayment would relieve these financial burdens and aid the caregivers in our state. Thank you, and go Pack.
Thank you for joining us. Next caller in support.
If you recently just joined us, we are currently in support of SB 266. If you would like to testify in support, please press star 9 now. Chair, you have no more callers wishing to testify in support at this time.
Thank you. Senator Taylor, you have a room full of UNLV Honors College students. That Go Pack, they might come up and take back all that testimony and support. We'll see what happens right here. Those wishing to testify in opposition to Senate Bill 266, please come up. I see all the red getting up. Seeing none in Carson City or Las Vegas, BPS will go to the phone lines. Those wishing to testify in opposition to Senate Bill 266.
If you would like to testify in opposition of SB 266, please press star 9 now to take your place in the queue. Caller, you are unmuted. Please continue.
Barry Johnston, BERRYJOHNSTON, Las Vegas. The oversight last session was not restoring pay for doctors that Nevada government lowered, causing our health crisis. Someone mentioned that the reduction in pay and our sharp decline in medical providers. Now we are in a dangerous trend destroying our healthcare system, government intervention through socialist policies and repaying school loans. These bureaucrats thought that they could cut doctors' pay, dictate their value, and expect them to stay. Well, guess what? In just our family, more than half of our doctors moved, and student doctors at Spring Valley Hospital's GME program killed my mom because of what you did. Now, instead of fixing their mistake, restoring fair pay for doctors, they want to throw our tax dollars at student loan repayment bribe to young doctors working in an unsustainable system. It's nothing but a Band-Aid and bullet wounds. Are you requiring them to repay if they move after 5 years? These imported students leave back to their home countries and states. The real solution, stop punishing success, stop government wage controls, pay doctors what they're worth. You get what you pay for, and right now we are punishing the best and brightest out of medicine. We don't need more government handouts. We need free market with skilled professionals are valued, where patients have choice and where government isn't in the way. If we want doctors to stay, we have to restore their pay, restore their freedom, and let the market work. Even with these socialist experiments, we hated this when Biden did it, and Nevada needs to restore pay for doctors instead of allowing students to kill people like my mom. It's time to fix the problem with real solutions. Are there any bills restoring pay for doctors, or are you guys just going to keep letting them move? Thank you.
Thank you for joining us. Next caller in opposition to Senate Bill 266.
Chair, you have no more callers wishing to testify at this time.
Thank you. We'll stay on the phone line. Is there anybody wishing to testify in the neutral position for Senate Bill 266?
If you would like to testify neutral on SB 266, please press star 9 now to take your place in the queue. Chair, you have no callers wishing to testify neutral at this time.
Thank you. And with that, anybody in Carson City or Las Vegas wishing to testify in the neutral position? Seeing none, Senator Taylor, any closing remarks, please?
Thank you, Mr. Chairman. Angie Taylor for the record. This is really, in conclusion, Senate Bill 266. It represents a very small but a very important step towards Nevada's efforts to expand behavioral health in the underserved communities where we need them most. I urge your support of Senate Bill 266, and I would like to go on the record that I'm wearing a red suit. Thank you, Mr. Chairman.
Playing both sides like a true elected official. Thank you, Senator Taylor. Great presentation. Appreciate everybody who joined you. With that, we'll go ahead and close out the hearing on Senate Bill 266. And at this time, we'd like to invite our very own Senator Skip Daly, who very enthusiastically will present Senate Bill 298. And we should be somebody joining us on Zoom. If we could just have our folk help us connect them.
Yes, Chair, 1 second.
Chairman, members of the committee, Skip Daly representing Senate District 13, here to present Senate Bill 298. So this bill came to me, was assigned, was requested through leadership to work on this bill. So we're here to present that, and we have Mr. Troyce here to help co-present if you guys have questions, and we have their legal counsel on Zoom on that. They can tell you the story and the genesis of the various things behind it. I do have a couple of comments I would just say as we go through the bill. So the amendment is what we want to work off of, and similar to the question we had before, we're deleting Section 1 of the bill, the provisions of NRS 288-110 that was unchanged by this bill will still live and be happy in statute with no changes on that. In Section 2, we're proposing to amend NRS 289.010, which is the Peace Officers Bill of Rights, is what it's commonly known as, to add in the provisions in there what punitive action means, is the transfer to denial or increase of either in seniority or compensation. And then after a little bit of discussion back and forth on where, if it didn't go in Section 1, and we were looking at it, and I started asking questions so I could understand it, where they had it, which was in the 288 provisions for the EMRB, addressing unfair labor practices, et cetera, at the state level. We both came to the conclusion that it doesn't belong there. We felt it still belongs in 288, but more in the sections of collective bargaining. So as you can see in the amendment here, we're proposing to add some language to NRS 288.050. And that language was what was provided by the by Troyce here and his folks. Just a comment on where they're trying to go on when they do this. I was talking with some of the stakeholders earlier today. So I don't think this favors management or labor. I understand management is going to come up in opposition, which is perfectly fine. It's not hard to figure out if I'm going to be on the side of labor or management. You know, it's not hard to figure out where I'm going to be on that. But when you're looking at this and you're looking at it just from a practical standpoint, there are any number of things, thousands of potential things that are not specifically covered in a collective bargaining agreement that come up during arbitration, and you say, hey, you know, we have the general principle, we have the outline, and now a decision has to be made on this in the particular case, and Troyce can explain a little bit further. So some people have said, well, we can just take care of it in collective bargaining and we can add that thing in. I think the precedent for that is risky on the labor side, because if you do that and you continually do that over a period of time, arbitrators, lawyers on the other side will say, well, if we meant it to be covered in the collective bargaining, you'd have put it there. And over time, so then you're always going to be fighting what's the next issue that we didn't think of. And you can have 10,000 words in collective bargaining agreement, not cover every single scenario. So I think this general language will be beneficial to both sides in the long run. That's just me, having worked in the industry for a little while, is you can't anticipate everything. So just say it doesn't favor either way if there's something isn't 100% or specifically, and allow the arbitrator to make a reasoned decision based on the facts of the case, rather than saying, oh, it's not in collective bargaining agreement, so I can't rule, or I'm going to rule in favor of management, or vice versa. So this would give that little bit of latitude on that. With that, I will let Troyce here explain a little bit of the situation that we got to from here, but we think we hit on the right spot where this goes. And I think overall, this will be more beneficial than harmful, and beneficial to both sides.
Good afternoon, Chair Flores, members of the Hardworking Government Affairs Committee. My name is Troyce, T-R-O-Y-C-E, Krumme, K-R-U-M-M-E, and I am the current chairman of the Las Vegas Police Managers and Supervisors Association. We represent the sergeants, lieutenants, and captains that are employed with the Las Vegas Metropolitan Police Department. Joining me on Zoom is our general counsel, Dan Coe, to assist in answering any legal questions that the committee might have. As a leader of an employee association, one of my main responsibilities is to ensure that my members are enjoying professional and fair treatment from their employer. One of the ways that we accomplish this is through collective bargaining. NRS 288 allows for certain public employees to collectively bargain with their employers. This process sets the guidelines for the relationship between the employer and the employee, and at the core of that relationship is the collective bargaining agreement. The CBA dictates for both sides what they are and are not allowed to do over issues subject to mandatory bargaining. On occasion, the two sides will have a disagreement about whether the CBA was violated. The grievance process is enacted and unless resolved, ultimately lands in an arbitration setting. The arbitrator hears both sides and renders a decision. We believe that we have identified a flaw in the system that this bill aims to correct. What happens when contract language is silent on a specific topic? Traditional contract interpretation states that the terms should be construed against the drafter of the clause. In contract negotiations, we present changes to one another and do not believe that the bargaining process should be used against either party. This bill would prohibit the fact finder or an arbitrator from drawing an inference that benefits either side. It is an impossibility for either side to think of every possible scenario that may arise and bargain it. As an additional benefit, this bill would encourage both sides to come to the table and negotiate terms when those times arise where silence or ambiguity are identified, rather than one side taking a chance that their action will prevail in an arbitration. This bill also changes NRS 289 to further define punitive action, which would include a denial of an increase in either seniority or compensation, commonly referred to as a step increase or a merit increase, which we believe are necessary. We had a member who was denied his negotiated standard step increase without due process and without any finding of fault. The department denied his increase because he was under an administrative internal affairs investigation at the time of his anniversary, which he was due his step increase. Once the investigation was later completed, the department then demoted the member. In effect, this member was disciplined 3 times for the same set of circumstances. He lost pay from not getting his step increase. He lost rank through the demotion, which comes with a loss of prestige, because as police officers, we look forward to our promotion, which resulted in an additional loss of pay through losing pay in the demotion process. We believe that this is wrong and excessive. The taking of any part of a person's salary is a major discipline because of the compounding nature of one's salary and the reliance people have on their income. This change to NRS 289 protects all officers from having pay increases denied without due process or losing seniority without due process. With that, we'll take any questions.
Thank you for the presentation. I don't know if you wanted to punt anything over to your counsel, but we could just have them on for technical questions. That's fair.
That's what we prefer, Senator.
Perfect. Understood. Members, any questions? We'll start with Senator Rogich, please.
Thank you for the presentation. I noticed that there is no effective date for this bill. When will it take effect?
We would expect it under normal due course, which I believe would be July 1 under NRS. Oh, please correct me. Oh, October 1. Thank you, Senator.
For the record, this is Heidi Clarkson. Just to clarify, anytime a bill does not have a specific effective date, it is effective October 1st of the current year. A lot of bills are either effective on a different date or have a mix of effective dates, but when there's no effective date section, there is a provision of NRS that does say that such a bill would be effective on October 1st. So in this case, it would be October 1st, 2025.
For the record, that was Troy's Crummy. For the record, Senator, I apologize, not going through the chair.
Thank you, no worries. Members, any additional questions? Seeing none, and I think this, and I've, just for a point of clarification, and looking specifically at 289 in the Bill of Rights, and adding the denial of increase or seniority or compensation, et cetera, can you walk me through the hypothetical presently as the law stands before we change it? I understand this would trigger a whole host of due process, but under the current law, if there is a disagreement and an officer is under investigation and they have their merit pay withheld, and let's say the investigation is ongoing for 6 months, if at the conclusion of that investigation and while the merit pay was being withheld, the officer wins, the arbitration wins, whatever investigation went on, and turns out he was in the right or she was in the right, are they entitled presently for back pay on those 6 months? Is that happening now?
Would argue that the law is silent on that, Senator. I'm sorry, Troy's Crummy for the record, Chair. I would argue that the law is silent. Typically, under standard practice in a situation that you just explained, back pay would be afforded, but that is not protected within the law.
Understood. And then maybe for some of the folk coming in opposition, if you have the answer to that question, I am curious to know, please. Members, any additional questions? Senator Krasner, please.
Thank you, Chair. Thank you for your presentation. So you deleted section 1, that's no longer in, okay. What would a law enforcement officer what would he be or she be investigated for? So this would come up. Thank you.
Troy's Crummy for the record. Chair, may I go direct? Thank you for the question, Senator. An officer or supervisor can be investigated for any level of alleged misconduct. To narrow it down to what they could be investigated for, that list is long and probably unending of what they could be investigated for.
Please follow up.
Thank you, Chair. If a law enforcement officer is being investigated for misconduct, is it typical that if they're found responsible of that misconduct, that they might be demoted or they might lose pay?
Troy Crummy for the record, Senator Krasner, thank you for the question. It depends on the level of misconduct. We have a negotiated, what we call a discipline matrix, which allows for certain levels of discipline, either a minor, could be a warning, a written reprimand, certain level hours of suspension, and then for supervisors, demotion and ultimately termination. It really depends on the severity of the allegation.
Senator Ellison, please.
Maybe you said this, I just didn't hear it. What if he's found not guilty? At that point in time, does he get his back pay back plus his promotion back, or does it just start all over again?
That would be up to the, Troy Crummy for the record, Senator. That would be up to the arbitrator. The arbitrator could choose to award back pay back to the date of the demotion, or the arbitrator could give the rank back, but without back pay. It would be dependent on the decision made.
If I may, it seems like to me if you're found not guilty, you're not guilty.
Troy Crummy for the record, I would agree.
If you're not guilty, you're not guilty. Senator Ellison, I think we agree with you. Members, any additional questions? Thank you, members.
Senator, if I may kick it to our attorney if he's got anything closing.
Yes, please.
Dan, do you have anything to add?
Mr. Chair Flores, Senators, members of the committee, thank you for giving me the opportunity to speak before the committee today. My name is Dan Coe, D-A-N, last name C. I am the General Counsel for the PMSA, Police Managers and Supervisors Association. And in fact, we do represent all sergeants, lieutenants, and captains at the Las Vegas Metropolitan Police Department. I think the chairman has hit it on the head. I think Senator Daley has hit it on the head. Our concerns with the first rule is construe against the drafter is an issue for us. We commonly seek changes with the department, and we don't want those written solutions used against us in the collective bargaining process. The fact that we drafted them shouldn't be used against us. The fact that they've drafted them shouldn't be used against the department. We think this is a mainstay of negotiations, and all associations should benefit from this process. It creates certainty in the negotiations process, and that's why we've brought this bill. The second part, with regard to punitive actions, one of the senators had asked, and I think was clarified with the final question, do they always get their payback? And the answer is no, they do not always get their payback. So the fact that they can win and not get it, obviously, is a big issue. And the fact that they can have their pay taken have a finding without a finding of wrongdoing, then have a finding of wrongdoing, then have a demotion, and then have additional pay taken, I think is one of our biggest issues. The punishment should fit the crime. And any discipline should be singular and not multiple. And I think that's the biggest concern we have. Thank you for giving us time today to speak to the committee. We urge the committee to support Senate Bill 298, and thank you for your consideration.
And thank you. I would like to invite you to hang on the line with us, only because I anticipate the opposition will have an opportunity to come up, and they may bring up technical questions that maybe you'll be the best person situated to address them. So I do invite you to hang out with us for a bit more. Members, any additional questions? Seeing none, thank you again for the presentation. I'll invite you to sit back in the gallery. And at this time, I'd like to invite those wishing to testify in support of Senate Bill 298. If you could please come forward.
Good afternoon, Chair Flores. My name is John Abel, Johnabel. I'm the Director of Governmental Affairs for the LVPPA. I wholeheartedly support this bill that the PMSA is proposing with Senator Daley. And I will also tell you, when it comes to the merit increases in pay, while rare, we have had officers at LVMPD who are put on a performance plan for maybe not making enough arrests or maybe not writing enough tickets, and they have threatened or they've had their merit increases withheld or put on hold without any due process or any investigation. So for that reason, we do support this bill. Thank you.
Thank you for joining us. Good afternoon.
Good afternoon, Mr. Chairman, excuse me, members of the committee and staff. My name is Rick McCann, for the record, MCCANN, currently representing Nevada Association of Public Safety Officers and the Nevada Law Enforcement Coalition. I'll make it brief. It's late in the day. We give a wholehearted me too and a true dat to everything that you've heard here today in support of SB 298. Thank you.
And thank you. Welcome.
Good afternoon, Mr. Chair. Committee members, Jason Lesher, Jasonlesher, Executive Director of the Washoe County Sheriff Deputies Association, and that'll also be a ditto for me as well. Thank you.
And thank you for joining us. Anybody else wishing to testify in support of Senate Bill 298, Carson City or Las Vegas? Seeing none in Carson City or Las Vegas, BPS will go to those wishing to testify in support over the phone.
If you would like to testify in support of SB 298, please press star 9 now to take your place in the queue. Caller, please continue.
Barry Johnston, Las Vegas. As a proud supporter of our law enforcement officers, the men and women who put their lives on the line daily to protect our families and our freedoms, many of my friends wear Metro's badge. I've grown up with Metro officers, and my friends' dads were officers. And I know firsthand the stress of the politics and the challenges they face, not from criminals, but from within their own department. Right now, we have constitutional officers facing retaliation simply for upholding their oath to the people. While some corrupt leadership shields those who violate American values, like the disgraced pedo sergeant sitting in jail for harming tourists on the Strip, the PPA president had to step in to protect our city from unconstitutional officers who tarnished the badge of leadership who was not disciplined. If we truly want to protect the good constitutional officers, we must remove the ones who abuse their power. Metro's general counsel fixing the Public Information Bureau would be a good start. Public record laws exist to hold the system accountable, yet violations to Nevada Public Records Act keep critical information hidden from the people. This protects the bad actors while exposing good officers to unnecessary risk. Sunlight is the best disinfectant. We demand transparency, we demand accountability, and above all, we demand our police be protected from corrupt leadership that operates against American values. I love Metro, I love my friends who serve, but we need leadership to fix the leadership and secrecy issue. The law is on our side. It's time to enforce it and love our officers. Thank you.
And thank you for joining us. Next caller in support of Senate Bill 298.
Hello, my name is Al Rojas. I live in Assembly District 12, Senate District 21. I'm in strong support of this bill. I support law enforcement, and we want to support our first responders. Thank you very much.
And thank you for joining us. Next caller in support, please.
Chair, you have no more callers wishing to testify in support at this time.
Understood. Thank you. At this time, I'd like to invite those wishing to testify in opposition to Senate Bill 298, Carson City or Las Vegas. I see folk both in Carson City and Las Vegas. We'll start here in Carson City. Good afternoon. Welcome.
Good afternoon, Chair and members of the committee. My name is Joshua Martinez. I represent the Las Vegas Metropolitan Police Department. I'm going to turn it over to our Labor Counsel down south, Jamie Frost, to put our opposition on the record. Thank you.
Thank you. Good afternoon. Welcome.
Good afternoon, Chair Flores and members of the committee. My name is Jamie Frost, and I am the Labor Relations Counsel at the Las Vegas Metropolitan Police Department. And I'm here to testify in opposition to Senate Bill number 298. This language is an attempt to address a grievance decision where an arbitrator determined that based on LVMPD's collective bargaining agreement and its civil service rules, the department has the ability to deny someone's merit for performance or misconduct reasons. The increase in pay in that case was not given because the employee was on modified duty due to him being potentially demoted. There is no right in which an employee is entitled to an increase in pay. He was ultimately demoted, and he was entitled to a hearing on his demotion, and the demotion was ultimately upheld by an arbitrator. The unions can certainly negotiate a process with the department for when an increase in pay is withheld. That may include back pay, and the department would be open to these negotiations. But instead of attempting to amend the civil service rules or negotiate the results of the decision to try and establish a process which would be grievable with the department, the proposed language attempts to add a provision to every collective bargaining agreement in the state. They have the right to negotiate limitations to when an increase in pay can be withheld, and they have. Currently in our collective bargaining agreement, when increases in pay can be withheld with regard to captains. But NRS 288 states that discharge and disciplinary procedures are a mandatory subject of bargaining. The proposed bill would mandate that an arbitrator in any CBA grievance be bound by the evidentiary limitation outlined in this proposed bill. This is an attempt to negotiate a mandatory subject of bargaining without actually negotiating the subject. Moreover, enforcement of and interpretation of the provisions of NRS 288 are within the exclusive jurisdiction of the EMRB. This amendment essentially takes the EMRB's authority and passes it on to arbitrators and fact finders. The language is vague and ambiguous and will lead to confusion, litigation, and uncertainty. It hamstrings an arbitrator from being able to make a decision either way, as it prohibits an arbitrator from drawing an inference in favor of or against either party. In every grievance, when a CBA is silent or the language is vague, an inference is being drawn for one party and against another. Moving to the proposed changes to NRS 289, adding denial of an increase either in seniority or compensation is also vague and ambiguous and will have unanticipated far-reaching impacts. This is not about pay being taken or a decrease in pay. This is about an increase in pay, and there's no property right to an increase in pay. That instead would have to be determined by negotiations. In order to be entitled to due process rights, the employee must have a right to the benefit. Pay is a mandatory subject of bargaining, and this change again impacts a mandatory subject of bargaining by making it a right to receive an increase in pay. Giving an employee a right to receive an increase in pay interferes with the language in 288 and collective bargaining. Furthermore, this bill does not distinguish between probationary or non-probationary employees, thereby potentially requiring an investigation and hearing for denial of merit increase in both circumstances. Let me give you a couple of examples. A probationary employee not progressing in their training, possibly looking at being non-confirmed, and this bill potentially requires the department to conduct a full investigation and hearing in order to say the employee is not deserving of a pay increase. Employees need to earn pay increases because it's not a right unless it's articulated and negotiated in the CBA. Furthermore, someone on relief of duty about to be terminated for potentially committing criminal acts. While awaiting termination proceedings, this bill may require the department to conduct another investigation and hearing in order to say an employee is not deserving of a pay increase. It's the exact officer we don't want getting a pay increase. And this is not just about merit, it's about seniority too. And when you're on leave without pay, you're not entitled to seniority increases. Denial of an increase in pay is vague. It could also mean promotions. In other words, if someone tests for promotion but is not ranked high enough to be promoted, it could potentially be interpreted to qualify as punitive action under 289. This also interferes with its rights provided in 288, as promotions and promotional procedures are a management right. Finally, if they want to add a back pay provision, then specifically state that. But in fact, this language does not even entitle the employee to back pay for a denial of a pay increase. Thank you for allowing me to speak in opposition today.
Thank you for joining us. Members, any questions? Seeing none, we may have you, never mind, we do have a question for you. Senator Ellison, please.
You're talking about what's happening between the arbitrator, but I do have a question. We all took an oath of office, says that somebody's innocent until proven guilty. But during that time, they're waiting to prove that if they're guilty or innocent, unless they're had to go, and be stepped down or leave until the investigation's over. My question is if that's the case, and they're still on duty even though they demoted them until after the arbitration, why would that count against them? It seems like to me we all go by the letter of the law that you're innocent until proven guilty, but here it sounds like, I might be seeing this wrong, and I might be wrong. It sounds like to me that you're being held to another accountability. Is that right or wrong?
Thank you for the question, Chair and Senator Ellison. That's why we do not decrease anyone's pay until we've abided by the disciplinary process. So we have a whole disciplinary process that's been negotiated with all unions, specifically the PMSA in this particular case. And until we go through the disciplinary process, an employee's pay is not decreased, but it's also not increased. There's no right to an increase in pay unless it's specifically stated in the collective bargaining agreement. In this case, it's not specifically stated. We might disagree on that, but nevertheless, that would be dictated by the collective bargaining agreement. So in that particular case, no increase was given, but no decrease was also taken until we complied with the disciplinary process as negotiated with the PMSA and then ultimately upheld by an arbitrator.
And thank you. Thank you for joining us today. I'm going to invite you to sit back. We may call you back up if there's another issue we'd like for you to clarify.
Thank you, Chair.
Thank you. I'd like to continue with those wishing to testify in opposition. Seeing nobody else in Carson City or Las Vegas, BPS, can we have anybody wishing to join us over the phone in opposition to Senate Bill 298?
If you would like to testify in opposition of SB 298, please press star 9 now. Chair, you have no callers wishing to testify in opposition at this time.
Thank you. Is there anybody wishing to testify in the neutral position, Carson City or Las Vegas? Seeing none, BPS, anybody wishing to join us in the neutral position over the phone?
If you would like to testify neutral on SB 298, please press star 9 now to take your place in the queue. Chair, you have no callers wishing to testify neutral at this time.
Thank you. And at this time, I'd like to invite our presenters back up and any closing remarks you may have. And if there's any desire to address anything that was brought up by the opposition, please.
Thank you, Mr. Chair, members of the committee. Again, Skip Daly for the record. And I'll let Joyce here go to any technical stuff on that. I would just, in my mind, try to clarify one thing that the opposition was saying, that you're not entitled to an increase. There's no entitlement. I would just say if I bargained for a raise to go into effect on October 1st, I certainly am filing a grievance if I don't get that raise on October 1st. I'm entitled to that. We're going to win that every time. So I'm not following that logic a little bit. That's my only comment. Thank you.
Chair Flores Committee, Troy Scrimmy for the record. I want to thank you once again for the time. I want to thank you for allowing some deference to the opposition side and allowing Labor Relations Counsel Frost to go over the 2 minutes. I think it's important that she have an opportunity to answer those questions. I am going to disagree that our step increases are not a right. In fact, they are a bargain for a right. Wages are a subject of mandatory bargaining. And in recent past negotiations, we have bargained away certain steps and we have bargained in certain steps. We have bargained where certain members, when they promote, what step they would land on, which would be an increase from the previous contract to. So to say that raise is not a right, as Senator Daley just said, we're going to disagree with that assertion being made, which is really the crux of the argument. So we appreciate your time. Thank you.
Thank you. Members, any additional comments, questions? Seeing none, thank you all for the presentation. And I presume that conversations will continue offline, but it might be one of those, you're either in or you're not. So it may be difficult to find middle ground here, but I appreciate everybody who did come to me beforehand to address their concerns. With that, we'll go ahead and close out the hearing on Senate Bill 298. And next, I'd like to invite those wishing to join us for public comment to please come forward, Carson City or Las Vegas. BPS, do we have anybody wishing to join us over the phone for public comment?
If you would like to provide public comment, please press star 9 now.
Chairman, is it possible for me to talk about a different bill that was not spoken today about, or not?
So anything that falls within the purview of government affairs, however, if it's a bill that we have heard already and or will be heard in the future, we would ask that you limit your comments to the date of that bill hearing, please.
Okay, well, there is a bill out there regarding handling cars that are abandoned. And I was doing my research, and there's a county in California called the Nevada County, and they charge $1 for DMV fees to handle these cars that are abandoned. Now, I'm an electronics engineer, and believe me, nothing hurt us more than to find out that many of the stuff that we were designing turned out to be toxic waste, within a year or 2 years, and that now they're charging disposal fees. Even when you go to have an oil change, you have a disposal fee. So I am asking when that bill comes, it's an assembly bill. When it comes to you guys may want to consider. And I think, after all the testimonies, it's going to cost money to get these cars off the road, and they're causing havoc all over the state. So I'm thinking that charging $1 for every car DMV fee, and maybe 2 or 3 for an RV, might be the solution, because you're not going to dispose of this stuff for free. So that's what I wanted to bring up to the Senate. And we definitely need to get these cars off the road. You know that I'm a neighbor. I'm part of several neighborhood watch groups. And these cars, especially on the east side, where Orange Shaw is, my senator, and yourself, you're seeing the problems that we're having. A lot of cars get dumped over here. So it's something for you to think about. And hopefully, you guys can do your research. You guys are smart guys, and I think it's within our budget. Let's not be penny wise and $1 short, and I think it's a good decision. Thank you very much.
And thank you. With that, BPS, do we have anybody else wishing to join us for public comment?
Chair, you have no more callers wishing to testify at this time.
Thank you. Members, we do have some committee BDRs that have come in, but I'm going to wait, as I want to make sure that the folk who were involved in putting them together are in alignment with exactly how the language came out. So we'll go ahead and wait and to do that on Monday. I appreciate everybody's questions and participation today. We will be back here on Monday at 3:30. I do want to remind folk, as deadlines are approaching, it will be common for us to at times meet earlier to accommodate longer bill hearings. So while we're accustomed to starting at 3:30, we may be starting a little bit earlier on certain days. So just please be aware that we may be sending emails out, and/or for those of you following along, know that sometimes we're subject to just try to get more things moving in a certain day. So please don't take that as a sign of us trying to hide the ball. Thank you all. This meeting's adjourned.